Okay. I love it. All right, everybody. Chapter 10. Yep, we can all see this, I hope. Cool. And let's take it from there. By the way, some of this is useless information, and I'll let you know that too. But some of it really does apply to your daily massage life, and that's what we're always kind of looking for here. Like, what should you know when you go work at a massage place? Okay. Some of the premise, actually, of this entire lecture is that how well you set up your treatment often is how well it goes. So as important as it is that you do a great massage, often the questions you ask at the beginning, the way you set up your room, the way you set up your client's expectations really helps guarantee your success or failure. And really, I feel like when I was a massage manager, that I really kind of dealt with two types of problems. One that I dealt with very rarely was a complaint about the quality of the massage. The one that I dealt with more commonly was a complaint about the communication that went on in the massage. And they didn't come out and say, I'd like to complain about the communication, but expectations weren't set up, or the massage therapist didn't really glean what that person wanted and wasn't able to deliver on it because they just didn't ask the right questions in the beginning, things like that. Or somebody overstepped a boundary in that way. I don't mean in an inappropriate way, but I meant like they didn't handle the massage room itself. So today we're actually talking a lot about what you do in the massage room, really. Let's see. So, scope of practice. This is an important one. Your massage license allows you to do certain things and not do others. Your massage license essentially allows you to touch people. And that might sound like, oh, I can touch people now. No, you can't actually. You can't touch people for money right now. You can touch people walking down the street, just boop, boop, but you can't get paid for it. And your massage license really allows you to get paid to work on people. And I really want to caution you about this too. Because right now, technically speaking, if you accept a tip for your back rub, you're breaking the law. You're actually not licensed to do it. Does that mean it never happens? No, I'm sure people do it, but I sure wouldn't advertise or talk about it because technically speaking, I've talked to the state board about this. I'm like, why can't they take tips? And they had a really good argument, which is they said, well, think about it. Everybody can massage a back. Like, you don't need a license for that. We are licensing your ability to conduct business this way, and business is defined as exchanging money for a service. So the minute they accept it, you can call it a tip, you can call it a chicken, you can call it whatever you want. But the fact is, they're running a business at that point. And so that's why they say that. And you will actually see people get a massage license who are not massage therapists because they want the scope of practice the license allows. So let's suppose you are a Reiki master, which is kind of energy work stuff, but you really can't legally touch people and charge them for it. Massage licenses allow you to do that. I even know physical therapy assistants. So physical therapy assistants are much higher trained than we are, in my opinion, but they will sometimes come and get a massage license. So they're already allowed to touch people, but they have to be supervised. So a physical therapy assistant has to be supervised by a physical therapist. Has to be. Has to be one in the building at the time and whatever. But if they get their massage license, all of a sudden they can stretch clients and work with them without supervision because your massage license allows that. That is the scope of practice. So some of the things that are not in your scope of practice that you should not be doing is chiropractic adjustments. That's a big one. Now, you've probably noticed if I've come by your body in lab that I've pressed down on your back and maybe a little thing adjusted there, but I am not twisting you around and trying to what we call force an adjustment. There is such a thing that we call in the business, we call a self-adjustment, where you have created enough space that things just kind of drop into place. And of course, you don't get in trouble if an adjustment accidentally happens, but you're not a chiropractor. That's one example of stuff we're not able to do. We're also not able to break the skin. So things like acupuncture and things like this really shouldn't be done under your massage license. We're not qualified to do it. It's one of the reasons you guys aren't more heavily regulated is because we don't break the skin. So the fact is, if you're respecting your client and all that kind of stuff, really, massage is probably the safest medical modality out there, and they don't regulate us very much because they know if you wash your sheets and your hands, and you're kind and respectful, that it's super safe. Whereas things like if you're an esthetician, the aesthetics board is actually much tougher. But they know that you are breaking skin barriers, and that if your needles and implements aren't clean, that you could be transmitting all sorts of diseases to people and things like that. So anyway, essentially our scope of practice allows us to touch people, but not adjust them and not break skin. And we have to stay inside our scope of practice. Yes, Ms. Suriel, please.
One question, what about cupping? Do we need like a special certification or?
No, you're not breaking the skin with cupping, and you can do it. You can do it.
Same as hot stone or things like that?
You can do hot stone too. You're not breaking the skin, you're just using a tool to rub with. So yes, you can do that too. And by the way, now, it is ethical for you to get trained in hot stone and get trained in cupping and get trained in reflexology. It's ethical for you guys to do it. You probably should, if you're going to call yourself a reflexologist or cupologist or whatever. But license-wise, it's not required. Like, once you get your massage license, you guys can go do maternity massage. I would not advise you do maternity massage until you get some training in it, but legally speaking, you're basically okay. Now, the place you could run into problems is if something went wrong in that massage and they tried to sue you, the first thing they'd ask for is, what training do you have in this specific thing that you're doing? And you'd be like, I don't have any, and that'd be a problem. But I just want to let you know, your massage license allows you to do cupping, hot stone, pregnancy massage, sports massage, deep tissue massage, reflexology, stick massage, rock massage, dog massage, not dogs, never mind, that's something different. There is such a thing, but it allows you to do any type of thing like that. Yep, you're cool. And you can use mechanical devices as long as they don't break the skin, but those kind of things that you can do all that. Yeah.
Oh, thank you.
And did somebody else have their hand up? I feel like somebody else had their hand up for, am I just losing my mind? Okay. Anyway, yeah, am I losing my mind? Ms. Trotter, did you have your hand up? Uh-huh. And you were going to let me just kind of spin away on that, huh? Uh-huh. What did you want to say, Miss Trotter?
I was just going to ask about, I think it's called acupuncture, the ones with the little sticks. I was like, because I know that can like you're putting them into the skin, but I don't know if that still counts as breaking the skin.
It does. You can't do it. By the way, Miss Trotter, I'm not saying that nobody does it. I know people that practice without a license. I don't really care. But the fact is, you're not supposed to do it, and you can get in fairly big trouble for this stuff. So, stay in your scope of practice. And let me give you all one more example where it's easy to slip out of your scope of practice. You might start playing psychologist with your clients. It's a very easy thing to do, right? Because they're sharing all their problems with you. So it is completely fine for me to say, oh, Miss Trotter, I completely understand of how upset you must have been when you lost your lotion behind the bed. That makes perfect sense to me. That's not me playing psychologist. That's me sounding back your frustration over your lost lotion. But if I start to say, you know, I think this habit of you losing things, Miss Trotter, might stem in your childhood, that's me playing psychologist. That's actually out of my scope of practice, and many massage therapists kind of fall in that route. So I am kind of careful in my treatment rooms. It's not that I never give advice, I do sometimes, but I'm careful to basically be a sounding board. Oh, that sounds like it was very upsetting. Oh, that must have really, bothered you. Oh, that sounds like a great thing. To make sure they're just hearing themselves talk, because most people do most of their processing by just hearing themselves talk, and you can do that all day long. But anyway, scope of practice. So basically you are supposed to be massaging. Make sense? Everybody? Yeah? Good stuff? There's a lot of giggling going on. Is there a side conversation going on that I'm not aware of? Probably. Lots. Yeah. Uh-huh. I was pretty sure about that one. Okay. Good stuff. Okay. So in your scope of practice, you can do all the stuff that pertains to massage. I can ask you any question I want if it pertains to massage. So I can ask you what your daily activities are like because it might pertain to massage, right? I can ask you, probably could even ask you dietary questions. I don't think they directly pertain to massage, but I could probably ask you that, but I couldn't give you dietary advice back. I couldn't say, oh, well, maybe it's those Big Macs, right? But I can ask any of that type of stuff. And yeah, that's it. That's it. So one of the things to remember about scope of practice too is that somebody else's scope of practice is not your scope of practice. So that means if I work for a chiropractor and he says, go adjust this client for me, you can do that under my license. No, I actually can't do that under his or her license. And their scope of practice is not my scope of practice. Just because they told me they could, that I could do it, doesn't mean I can do it. So just remember, your scope of practice is your scope of practice, right? Doesn't matter who told you. Oh, well, here's all the stuff I already talked about. You can't do acupuncture. Manual thrusts are adjustments. Laser stuff, dietary and nutritional counseling. Cosmetology, you can't be doing people's hair. We're allowed to mess it up, but we're not allowed to fix it. Even ear candling, which many therapists do, by the way, is considered a no-go because it's going inside the body and it's not really massage. I wouldn't worry about it, but I'm just saying. These are good examples. And psychotherapy, you are not a psychologist. You're not a psychologist. If you ever run into by the way, I should have said this at the very beginning. I apologize. But we'll be talking about some of the things that can go wrong in a treatment room. I am happy to say that in general, massage therapists almost never get sued. And we know this for a fact because of the fact that I can get $10 million of liability insurance as a massage therapist for about $150 a year shows you how little they get sued. Because otherwise, if you're a doctor, that amount of insurance would cost you a fortune. We don't get sued that often because massage is actually quite safe. So I'm talking about some worst case scenarios or alluding to them here. I wouldn't worry about them. But if there are problems, one of the things they look at is something called standard of care. And they use this in courts. And standard of care is, what is the reasonable care that somebody in the industry in your profession would provide in this situation? And did you do something similar? So if you came in and got a back rub for me because your back hurt, and then later you said it was even worse and we went to court over it, that probably never would happen, but if it did, they'd say, well, what did you do? And I'd say I'd rubbed their back and I'd show how I rubbed it, and the person would say, yeah, that's true, that's what he did. And then the court would say, well, that seems to be pretty reasonable. That's what massage therapists do. We know thousands and thousands of them are rubbing the back. This person was performing in the standard of care. They were doing what's typical to do. It seems like reasonable behavior for this profession. But if the person came in and with their back hurting, and I tried this new move where I throw them off the table onto a chair to kind of snap their back or something, they would look around the industry and say that is not typical, that's way outside the standard of care, that seems like unreasonable behavior, and you are now at fault. That's how they figure out if you're at fault as the massage therapist. Is the question in court is always, were you operating reasonably? Reasonably. And by the way, this is a standard that's used in all sorts of court cases. When you hear about all this stuff about police shootings and things like that, by the way, I'm not passing a judgment about police shootings. It's a very hot topic. But what they're looking at theoretically in court was, is this officer acting like a reasonable officer would act in this situation? Is this massage therapist acting like a reasonable massage therapist in this situation? Is this doctor doing what most doctors would do in this situation? That is where you're looking at a standard of care, if that makes sense. And I tell you all that in this long-winded, boring speech of mine to tell you that it's one of the things I ask myself sometimes when somebody says, hey, could you go deeper there? Could you do that thing? And I think, is that reasonable? Like, I don't mind if it's a little aggressive. I don't mind if I like to be a little edgy in my massage and go in pretty deep and things like that. But is it reasonable? Are we starting to kind of go in that realm of did you really think it was a good idea to use your elbow on their throat? That doesn't quite seem reasonable. That kind of stuff, right? So just, is it reasonable? Could I actually stand up in front of a group of people and say, this is why I did this? I do the same thing with my teaching. Ask myself, could I stand in front of the State Board of Massage Therapy and explain how we spent this time in our class? And the answer is yes, I could. And so it's reasonable care. Cool. It's very good if you're consistent among clients. So that doesn't mean you treat all clients exactly the same, because they all should be getting a customized massage. But it's great if anything comes up and you can be like, these 25 clients will tell you that I always do this. So if some client came forward and said, Mr. Tapscott didn't drape me properly, it's great if my clients go, all of them go, no, he always drapes this way. He never ever doesn't use a drape. He does, right? You don't want people coming forward and saying, oh yeah, sometimes he does that, right? So treat your clients the same. You're trying to establish a pattern of reasonable behavior. Yeah. And all this comes up, by the way, because unfortunately when something happens in a treatment room, it's just he said, she said. Or she said, or he said, he said. You know what I mean? Mr. Ariel, yes.
I have one more question. So could this get into the category that you're talking about? Let's say I go to one of these exotic places where you can get these massages where they break your back and, well, I don't know how to explain, but they stretch you and they do all things. And if I'm a massage therapist, I can say, oh, I learned how to do it, and then I come, and then I do that to one of my clients, and then something goes wrong, and I hurt that person. Could that enter into this? I'm not trained on that, but I don't know if that could. I just wanna feel that don't try something that you're not trained on.
Yeah. I think you said it best right there. Don't do stuff you're not trained on, because that's the first question they're going to ask you if it became legal. Is they're going to say, what made you think you could do hot stones? And you'd be like, well, I took a course in Sedona on hot stone massage. And they go, oh, okay. So it's good that you've had some training in it. Yeah, especially if it's something that you think could do damage, right? If I decide one day I want to roll this tape on somebody, I don't need training for that because I don't think that I'm probably ever going to get sued for this. I might lose clients, but I'm not going to get sued. But if it's something trickier like hot stones where you can burn somebody, it's really good to have some training, yeah. So that you can speak that, like, I've got training in this. I don't know what happened, but I've got training in this, yes. I hope that answered your question.
Yeah.
Okay. Mr. Riedel?
Yeah, so like what about time massage? Because you're doing like lots of, like you might be stretching the client sometimes, and those movements, I mean, it's kind of like not, I mean, I don't know, there's just movements of moving the client, and it seems kind of like you could hurt somebody doing that.
Well, you can, that's true. But the good news is that it's still stretching and massage.
So like like you said in the courtroom, is that something that would be considered normal behavior in the practice? Like stretching, like?
I think so. I think so. And I sure would sell it that way if I was the therapist. I'd say, well, yes, it's true I had their leg up in the air while I was doing this other thing because I was stretching them and massaging them. That's what massage therapists do. Yeah, I think you'd be well within your scope of practice. And I admit that lots of therapists don't do Thai massage, but it's still a very common thing. Yeah. And as long as you weren't trying to twist them to crack their back or something, no, you're just, doing those manipulations and you're stretching and rubbing. I think it's totally legitimate. You'd be fine. And I encourage it.
Okay.
I encourage it. I don't want you guys to leave today and be overly cautious because that's a problem. But anyway, yeah, no, you'd be fine on that. You'd be fine on that. And I often ask myself too, if I'm wrong, what's going to happen? So if I go too deep on a healthy person, what's going to happen? They're going to be bruised and sore. Probably not going to sue me for a lot of money for that. May or may not lose you as a client, but that's it. But if I'm doing some weird manipulation where I could break your neck, then I'm like, oh, that could be pretty bad. So you kind of measure what you're doing. And I actually feel Thai massage is extremely safe. But I love Thai massage. That doesn't mean it doesn't have to be done slowly and with some thought and things like that, but I think it's quite safe. It's as safe as stretching is. Okay, other questions? No. All right. Your book defines health literacy as the degree to which an individual can obtain, communicate, and understand health information services to make appropriate decisions. I could care less about that definition, although I think it will be on your quiz tonight. What we're headed to now is the client should understand and be able to understand what they're saying yes to. So they need to be able to make informed medical decisions about their treatment. And so if I'm giving somebody like Miss Jung no, you're fine, you don't have to answer. I'm just using you as an example. She's like, what? If I'm giving her a long, lengthy explanation and I'm talking really fast about something I'm going to do in massage, and I'm like, yes, is it yes? Is that okay? Yes. And she's finally like, yes. She has not made an informed decision. She was not able to be informed, right? She's smart enough. That's not the problem, but there's a language barrier, right? The degree to which she can communicate and understand health information is highly limited because I'm not speaking in her language. So I would still massage her, but I wouldn't ask her about some crazy complicated thing that she's not going to understand that I want to do in this massage. Whereas I might be able to explain that to somebody else, right? So just remember that it's not only your duty to talk to your clients, it's your duty to make sure they can understand. You will hear about this a lot. HIPAA. Health Insurance Portability and Accountability Act. What does that mean to you? What that really means to you is to protect client information. And that you really shouldn't share client information with somebody unless you have client permission. So even if I'm working on one of you and I'm like, oh my gosh, I know a doctor could really help you with this. I went ahead and shared your files with them and how our session went and stuff like that. If I don't have clearance from you, that is a no-no. So that's a pretty big deal because you're more likely to be sued for something like that than anything else. You're not usually doing this type of stuff. Like in my home practice, it wasn't like I was going to be sharing your records with anybody anyway. But just remember, get permission. I would get an email or written permission that you can share records if somebody really wants you to refer out. And if you are sharing records, it's going to be rare, by the way, but it's usually with an insurance company. This person's got in an accident and the insurance company wants some of your notes to substantiate that this person was in an accident. So, but you still need your client to say yes, right? There is really only one exception when you can share client information. Well, actually several exceptions all closely grouped together here. When you can share client information without their permission, and that's when you believe that they are in immediate danger or they're going to cause somebody else immediate danger. So if your client does tell you that they are going to kill somebody on your table and you believe them, you need to report that. If they say they're going to kill themselves on your table and you believe that, you need to report that. If your client is elderly or underaged and you believe they're being harmed, you need to report that. Those are the only scenarios I can think of, right? For better or for worse, this will probably never come up for you because unfortunately people that are in abused situations don't go and get massage. And their abusers don't take them to massage. And people who are going to murder people don't usually tell other people. So, and they don't get a massage right before to relax. So it's very rare, but those are the times you can. When you believe that there is an immediate dangerous threat to that person or people that they might know, you can share information in those situations without permission. Yeah. And those are very hard decisions to make, by the way. And I will add one other little caveat. The minute you share with your manager or another coworker that your client said this, now you've really got to report it because you now have evidence that this was told to you. Does that make sense? So if you are really going back and forth like, was Tapscott really going to kill himself or is that just a phrase he uses? Well, if you think it's a phrase I use, then keep it to yourself. If you think I really meant it and you've shared it with somebody else, you now have to report it because we now have evidence that that I said something because you just told your coworker about it too. Does that make sense? Thoughts? Saw a couple Eyes move, maybe? No? Okay. HIPAA also says you should keep client records locked up, by the way, but I think you're going to find that you guys don't have the type of records that really need to be locked up. And I'll tell you, the client records that I was protecting would have fallen under HIPAA, but I was protecting more because they were personal information. Like, I would write down stuff about my clients, like their kids' birthdays, their favorite thing to have done in massage. And I did that not to be creepy. I did that so I could be like, oh my gosh, your son's birthday's coming up, right? Which I would never remember that. But I have it on their client card. Yeah, and I have it on your client card, like, oh, this person loves feet, or this person hates whatever, or that kind of stuff. So it's personal information, and that's not okay too. I can't give that to one of my friends and be like, hey, you're working on Jack, here's all the stuff he likes. Not supposed to share that either. And some people do, and it backfires, even though it's meant very innocently. So any type of personal information, what's shared with you in the treatment room should stay in the treatment room. Yes, Ms. Trotter.
So does that go the same thing for like soap notes? So like when you're writing notes and stuff like that? Because I know with like Massage Envy, the therapist puts it into iPads, and my understanding is that the other therapists can see. And I don't know if 100% true because I never did it or seen them, so I don't know if that goes the same for those.
Yeah, so I suspect, and don't quote me on this, but I'm pretty sure, I suspect what Massage Envy does, and Elements and places like that, is when you sign up for massages with them, they say, hey, we have the right to share your information with any therapist who might work on you. And it's a benefit to you, right? So Ms. Trotter, you came in and you got a massage from me, but next time I'm not there, and you'd like the person that's going to work on you to look at my notes to know what we did. And you have already signed that right away. Right? And it's very specific. Doesn't say I can share it with another location. Doesn't say I can share it, for personal reasons. But it says in order to treat you better, another therapist can look at your information. In that situation, yeah, and they probably had you sign that right away. Yeah.
Yeah, it's probably in our long little disclaimer thing that like no one ever reads.
No one ever reads. By the way, you know the reason that people have you sign disclaimers? They're not legally binding. You cannot sign away your legal rights to sue. You can sue. They're there so you think you can't sue. So we love to have you sign that stuff so you go, well, I signed a disclaimer, so yeah, my neck's kind of messed up, but I did sign that thing, so I'm not going to say anything. That's what we hope you do if we're running the place. But they don't. They don't stop you from that. You can come back and be like, no, no, no. But you're right. Nobody reads those. Who would read those? Terrible. Your book, and Legally Speaking, recommends double locking all clients' records, which means they're in a locked room in a locked file cabinet, or in a locked computer in a locked house. It's pretty excessive for the type of files that we're going to keep. Most of you will not know really specific information about clients. But I will say, if you have things like credit card information, social security numbers, things like that, keep that stuff locked up. And remember, if it's on your computer and your computer's on the internet, somebody can get access to it. And social media. Don't post pictures of your clients on your social media sites unless you have their permission. And by the way, many of them give you permission. But it's something I watch as a teacher a lot, right? I'll get pictures of you guys for our slideshow, and I'd love to post them on my Instagram or something, but I have to have permission from you first, right? So don't do that. And this even applies to public interactions. And this one you might not think about. So, Miss McDowell is my regular client. I see her all the time. We're best of buddies. We talk about all sorts of stuff. I love her as a client. And then I see her out. I see her out and I'm like, hi, Miss McDowell. That's Miss McDowell. I'm her massage therapist. Well, you can't do that. For one thing, we don't know if Gabriel knows she's getting massages. And he might be really mad. He might be mad she has a male therapist, especially one that's good looking. Like, that could make a guy a little, a little edgy. So the point is, you don't do that. Now, if Miss McDowell says, hey, Mr. Tapscott, whatever, that's fine. That's completely fine. She's acknowledged me first. But we don't even acknowledge people out in public. I have seen clients out in public, and if they don't say hi to me, I don't say anything. It's their time. Now, usually, by the way, they say hi to you and they call you over and they tell everybody that you're their therapist and they should go with you, and that's fine. Just make sure that they initiate it. That's all. I mention these things because I've seen this happen to people where their intentions were really good, but it just didn't go so well. And they weren't, they weren't doing anything wrong. They just didn't really think about all that. Cool. All right. Just looking, scanning faces. Okay. All right. It is very likely when you do your massage that you will do an assessment of some sort before you start your massage. There are all sorts of levels of assessments and things to really think about. Really think about. And by the way, we will take a break here in just a little bit. You obviously want a certain amount of information when you start to help make for a better massage. Here is the problem that you run into, and I don't have an answer for this. You need to figure this out. And I would say it depends on your client too. But the one thing is, I want lots of information on you when I start your massage. However, I don't want to take the time to get it. You don't want to take the time to give it to me. You want to get started on your massage right away. You tend to get more nervous while that's going on, and nobody's getting paid during this time. So, I tend to be on the opposite end. This is not what you should do necessarily. I tend to be on the opposite end of the spectrum where I'm trying to get you on the table as fast as possible, but some of that is coming from my history. I was a male massage therapist in this town 26 years ago when there was 3 of us. I'm sure there was more than 3, but it felt like that. Where it was an unusual thing to be a male massage therapist, and yet most of my clients were women. And if I sat down and said, okay, so this poor lady has never met me before, right? All she's thinking is what? She's thinking, I'm going to have to take my clothes off in a second. I wonder when I have to take my clothes off. Will I be naked? Will I be covered? I don't know if I should take my clothes off. Will I be behind the sheet? I wonder when he's asked. She's not listening to a word I said, and I'm asking her all sorts of medical questions and intake questions and where she's sore and what she's doing. And I found in the past that that is too much, and my clients just get more nervous, and I don't even always glean information that I might need because they're so nervous in the beginning that they're not even telling me all the stuff I want to know. And I've had clients do that, where I've said, are there any major medical conditions I should know about? And they're like, nope. And we get in there, and I had a guy do this. He goes, well, I did have open heart surgery 2 weeks ago. And he had a scar like this long, staples still in it, down his chest. They cut open his rib cage. I think that's fairly major surgery. He didn't mention that to me. So anyway, so you always have to strike this very weird balance with your assessments. And if you work for somebody, you just have to do what they tell you to do. But there's this very weird balance of, yes, I'd like to know stuff about you, but it also really helps when we get started the massage. I strike that balance way far on the other side where I just say, hi, my name's Mike. I'm going to be your therapist today. Are there any major medical conditions I should know about? Nope. Are we working on anything in particular today? Yep. Are we spending the entire session on that? Or are we just working that into your regular full body massage? Got it. Let's go. And then I will ask you the rest of the questions in the massage. Other therapists would say that's absolutely crazy, and very legitimately. They'd say, I want to know if they have high blood pressure. I want to know if they could be pregnant. I want to know if they're on blood thinners. I want to know if they're on painkillers. Those are good questions to know. It's really helpful to know if the person's on painkillers or blood thinners. Blood thinners make them bruise. Painkillers make them take a lot more pressure than they think they can take, and the next day they're bruised. But I tend to ask that stuff later, especially when I'm going deeper. And they're like, you can go deeper. I'm like, are you on any blood thinners, any painkillers I should know about? Nope. Okay. But that's just me. So anyway, that's something to think about. But your assessment is your evaluation in the beginning to kind of figure out this person's level of health and their function and any contraindications they might have, which would be health conditions. Ms. Trotter, does Massage Envy use soap notes? Do they call them soap notes, or do they call them something else these days? You don't know?
I don't know.
I don't either. Don't feel bad.
Okay. I've heard a couple therapists call them that, like when they're talking to us.
That's what we call them, even if they're not. Okay, that's helpful. Mr. Riedel?
My girlfriend worked at Elements, and she says that they use soap notes.
Cool. All right. So, everybody, the reason I asked if they use soap notes is there's a big change in the industry right now where people aren't using the exact format. Soap notes are a medical note-taking system that stands for subjective, objective, action, and plan. Depends on how you interpret it. But, and what it is subjective is you take notes on what did the client tell me? What did the subject tell me? My client said they had a hurt neck. It hurt, like out of 0 out of 10, it hurt at a 9. My client said that they got a stick in their eye. It looks bad, right? So that's subjective, though. They're telling me. Then I write the notes objective stuff. I went and felt their neck, and boy, it was really tight here, and they weren't kidding. That's objective stuff. Or they can't turn their head. That's something I can objectively witness and write down. I don't even need their opinion about it. So one is subjective, is the client's opinion in my notes. The next thing is objective. And then action or assessment is kind of what did I do during the massage. I massaged their feet because I'm convinced their feet will fix their neck. I didn't touch their neck. I would never do that. But anyway. And then the plan is usually the client's homework. Like I send them away with stretches and what I'm going to do next time. So this is very helpful like in a massage MV or element setting, right? Where if I'm not there the next time, somebody else can look at our plan and be like, oh, you guys were going to do these hamstring stretches because of low back problems and so. But anyway, that's what SOAP notes stand for. Don't sweat it. No matter what place you work for, they will train you how they want to do notes. And personally, for private clients, I think SOAP notes are overkill. For private clients, I think in general, SOAP notes are overkill. I don't think I need all that information. I need to remember what my client likes, doesn't like, things like that, anything they're allergic to and stuff like that, but I don't always need to write down all these SOAP notes for them. That's up to you. I think you need some kind of record to know what you're doing, but anyway, if you work for a place and you go in there and they say, oh, we don't use SOAP notes, we use Pico notes or whatever, it's just a different form of SOAP note and they will train you how to do it. And they really are notes. They really are like 3 sentences. Client told me this, I did this, this is what I witnessed, boom. That's it. They're very, very simple. I don't know of any place that doesn't use them and doesn't train them too. Because every place is very picky about how they want you to do them. And they don't just use SOAP notes in massage, by the way. They started in the medical industry. Cool. Okay. I wonder if we should take. Let's take a break before we get to pain assessment. Can we take a 15-minute break? Is that all right? All right. Come back at 4:28. See you then. Okay.
Cool. Yeah, there's some funny ones in there.
Yeah?
I learned that putting oil on hairy legs is ideal.
Yeah.
You think?
Well, that's what we want to know, though. I
Like
love
I said,
that.
why don't you just bring a shaver and some hair remover while you're at it?
All right. I'm going live here.
Oh, for the lab, is there a lab score for them today? Is it A, B, C, and D?
Oh.
Or just leave it alone? If I see it on the thing, I'll put it in.
All right, cool. Okay, everybody. And we're back. And we're learning. All right. Comments, questions before we get going again after our break? No. What did I say? Said, do you have any questions, comments, anything? Can you hear me? Yeah, okay. Don't mess with me. I'm easily confused, Miss Estes. We know that. All right. Okay, it's not funny. It's pretty funny. Okay, everybody. Pain assessment. Therapists are obsessed, probably because insurance companies are too, with pain assessment before and after a session. And they've got all these different scales, like numeric rating scales. Actually, that's what I'm most familiar with, to be honest with you. But they've got all sorts of different scales. You do not need to memorize the names for these scales, although I suspect I underline this because there will be questions about these tonight. But here's why they like to assess pain. For two reasons. One is a good reason. It's to see if there was improvement from the massage. So if you come in and your neck pain is a 9, and then I ask you on the way out how you're feeling and you say it's a 6, that's actually a fairly accurate feedback. You're the one who told me it was a 9 and you're the one who told me it was a 6. And so we've reduced your pain, 3 points down. Now it's all subjective, but it's reliable subjective. And we like that, by the way, because I can say, see, we've made some improvement in your neck pain. If you come back regularly, we can probably try to get this down to a 1, And so it gives us some goals to go for, things like that. That's very helpful. Insurance companies like to see it because it can be evidence of the need for treatment, things like that. What I caution you against is putting too much emphasis on any one of those numbers. Like a 9 to one client is not a 9 to another client. We all have very different interpretations of pain. So, kind of reminds me of what my friend said to his wife. She's pregnant and he said, honey, don't worry. I know exactly what you're going through because I've had a cold before. So, and he was making a joke about what a wimpy is, right? And the point is, being pregnant and later giving birth was a much bigger deal than him having a cold, but to him, that's his 9 right there. So the point is, don't put too much investment in what that means. For that same reason, I really strongly recommend against numeratizing your pressure. So some places do this, they can help better book you, that's fine. That's not what I'm talking about. I'm talking about sometimes you'll go see a therapist and that therapist will, they'll say, like, how are you experiencing this pressure right now on a scale of 1 to 10? What kind of pain are you feeling from this pressure? And if you say it's a 3 or you say it's 9, they say, well, we should be operating in a 6. And so they will reduce or increase your pressure to get you operating at 6. That is a horrible idea. I can't believe it ever caught on. I'm very opinionated about this. But it's a horrible idea because some people like to exist in the world of 2s and some people like to exist in the world of 11s. I love deep tissue. I want to tell you, like, it's good. Yeah. I don't want to be tensing up, but I want to be like, whoa, are you angry? Yeah. That's the kind of massage I want. So if you're operating at a 6, I'm not happy. I want a 9, 9.5. And if you are somebody who likes a 2, then I should not be raising you to a 6. So just be cognizant of that. This whole idea that massage is supposed to be experienced at certain pressures is not true at all. Not true at all. I do try to get in as deep as the client will allow me because I feel I can get more therapy done, but that's as deep as the client will allow me. And I don't push that. So if you're like, no, I don't want any discomfort, then okay, you don't want any discomfort. That's fine. It's your time. To me, that's like arguing with somebody how spicy their food should be. Like, that doesn't make sense. So I don't like it. I don't like it at all. Okay. I, by the way, do not for pain, but I do like very simple. Sorry, we're getting outside noises that are coming through my walls. Okay. Yeah, maybe I'm losing it. Anyway, I do like very simple forms for clients to fill out where there's like a picture of a body and they can just circle stuff that they want worked. That's what this chart made me think of. It's asking you just like, where would you put your pain on this scale? Don't even give it a number. Just go, is it really high up or really down low? But anyway, I love that type of stuff, not for pain, but just like, where does it hurt? People will like circle the shoulders and they'll put it, where do you not want me to touch? Put X's through that. And they'll put X's through the stomach or whatever. It's very, very helpful. It could just be the wind blowing down the building. That's honestly why I was kind of like, how big is that monsoon outside? Like, anyway. you guys would come rescue me, right? All 21 of you would drive over here and be like, we got to get Tapscott out. Cool.
Yes, yes, you would.
Thank you. Thank you, Mr. Tate. That deserved an affirmative response. Okay. Here's a great example of that. It's a body diagram. Circle where it hurts, put an X where we should avoid. This is very effective. It's very effective for you too, because you can kind of lay it down on the counter next to you to remind yourself. Because I tell you what, if you get into a routine, sometimes you forget. You're like, oh, don't touch the feet. I forgot. So it's very helpful. And I do like smiley faces and frowny faces. If you're going to assess stuff, these are very universally acceptable. Okay. The first 5 seconds that you greet your client are probably the most critical. And I ramp myself up to go meet a client, not because I'm not looking forward to meeting them, but because it's very easy for people to misinterpret your body language in the first 5 seconds. So let's say you've done 5 massages that day, you're tired, and you walk out and look tired. Unfortunately, what I interpret that is you are tired to see me. We can't help it. And so I make sure when I come out to do your massage, I'm glad to see you. Very happy to see you. Even if I look a little extra animated, I'm like, hi, I'm your therapist, right? Those first couple of seconds are really, really critical. And be very careful of any eye movement, especially if we're guys. Guys do this thing, I'll be very blunt, but guys do this thing where we scan your body sometimes. So it's just a fact of life. We're checking out your figure. We look you up and down. Well, it's not necessarily done by a creepy guy who doesn't even know he's doing it, whatever, but the client can see that. And if my greeting to you is, hi, and my eyes go up and down like that, that is not going to make you feel really comfortable about taking your clothes off next, right? It's going to bring up any self-judgment you have, anything like that too. So I'm always very cognizant those first couple of seconds, be like, hi, my name's Mike. I'm really happy to meet you, this person right in front of me here. And keep it uplifting. Anything I need to know about today? Any major medical conditions? I'm really excited to get working on you. Yeah, let's get going back here. We'll talk when we're in the room, okay? Boom, boom, boom. Let's go. But just remember, smiling. We fired a person at the Princess, and I agree with this, for not smiling. And she said, why? And we said, because it's literally part of your job. Because nobody wants this person. And people would tell us that about this person. We said, you've got to smile, but I'm not feeling it. I'm not feeling like being here talking to you about smiling. But that's my job, right? So make sure, because it's not, I don't want to turn you guys into a bunch of liars. That's not it. It's that people misinterpret your dissatisfaction with your current state as dissatisfaction with them. Nobody wants to get naked for somebody who's not happy to see them and smiling in a good mood. And I make that little joke, but it's really true, right? We're requesting somebody do something very unusual. Hey, I've just met you. I'd like you to take your clothes off so I can rub your entire body, but trust me. I can't do anything to mess that trust up, right? Now, obviously, my behavior in the treatment room is extremely important, but that first 5 seconds is critical. I would even argue the speed you walk out to greet the client is critical. I hate when I see people walk out with their hands in their pocket like, Burns here, sir, Mr. Burns. Don't. You are full of pep. You're about to give a massage. Is Mr. Burns here? Hi, my name's Mike. Like I'm happy to see you, you know, and clients will even try to they'll say stuff to be like, oh my gosh, I'm at the end of your day. You probably had 6 massages. I'll be like, that's the best one I do. And they're like, really? I said, yeah, I don't have anybody else after you. So I'm not pacing myself or anything. This is my best massage. Now, I don't know if that's true, but I want to put them completely at ease that this is the best massage. I'm not tired. It's not their business. It's not their problem, right? What would you do if you went to McDonald's and the guy's like, yeah, I'll get your hamburger, but I'm really tired. Yeah. And you know what? My neighbor's a nag. And no, we don't do that. So anyway, eye contact, build rapport really quick. Smile, smile, smile. Super important. And we're doing it to be nice. We're trying to put this person at ease. They're more nervous than you are, trust me. And they do feel guilty. 99.9% of people are really good people, and they do feel bad. I feel bad when my big fat butt is on your table and I'm asking you to go deeper. You know, I feel terrible. I really do. You know, I've got some nice 120-pound girl rubbing me, and I'm like, could you go a little bit deeper there? I'm twice your size, but I really, right? That's what but it's even harder if she comes out and she's like, wow, the day I had. Whew. Right? So anyway, all that stays at home. All that stays behind your smiling face. Right? And every client you see is your favorite client. Because they are your favorite client for that hour. Right? If any of you want to pay me $100, you'll be my favorite person too for that hour. Pay me $1,000, you'll be my favorite person for 10 hours. Cool? Yeah. And they really are. For that hour, you find those things that make them your favorite person. You make it true. Okay. The rest is some Tap's got opinion here. So you need to make your own decisions from some of this. But this goes back to what are we going to ask clients about? We've smiled now. We've made this incredible eye contact. They're at ease. But then there are questions that massage therapists ask. They ask, you know, why are we here getting a massage today? Have you had massage before? What kind of pressure do you like? I hate these questions. I hate them. So, most people can't justify everything that they do. I even ask them the reason for the massage today. I understand what they're trying to get at. Like, are we working on anything today? That's a better question. But sometimes people are like, well, I don't, you know, I wanted a massage. Is that okay? Yeah, you don't have to have a reason. So why am I even asking you that? And then past massage experience. If you want to make somebody feel inadequate, so have you had massage before? Do you know what you're doing? I don't need to know if you've had a past massage. Why would I need to know that? How is that going to change my massage? Do I really massage people differently that have never had a massage before or had a massage? And a lot of people argue with me and they say, well, they don't know the whole routine. They still don't know the whole routine. They don't know my routine. I want them to lie face down, underneath the sheet, all this stuff that I'm going to tell them about anyway. It doesn't matter if they've had massage before or not. I'm going to tell them that. And if they've had massage before for me, then I do know that. So I'm not saying you're a bad person or a bad therapist if you ask this stuff, but I'm just saying with the questions that you guys start to ask, because you're going to start to build a dialogue that you use over and over again with people and stuff like that. This will happen over the course of our program together and even afterwards. Ask yourself if these are questions that really help. Help put the client at ease or help the client be safer or help the treatment go better, right? Your past massage experience doesn't help me. Yes, Ms. Suriel.
Mr. Tapscott, I got a question, and this question is because you touched a little bit of what we talked today in class. So when we were massaging, somebody asked about how do you perform or you do a client that it's like a client, let's say, that comes to you two times a month. It's like, do you change the massage? Do you do something new? Or do you just keep going with the same thing?
Oh, yeah. What a great question. It depends on if your client is a person that likes to go out to the same restaurant all the time or a new restaurant every time. And what I mean by that answer, Ms. Suriel, it doesn't really matter what their restaurant preference is. I try to figure them out. Some people are very meat and potatoes people. And by the way, that's not a criticism. I'm one of those people in some ways. When they find what they like, they would like you to repeat what they like over and over and over and over again, right? And these are the type of people where they're like, that meatloaf was great last night. You could serve it again, right? I'm kind of one of those people. Once there's something I like, I'm like, yeah, we can do that again. We just did that last night. I know, I liked it. Let's do it again and again and again and again. Whereas, and some of you will relate to this too, my girlfriend is not that way. So she loves something and she's like, I loved this. And I'm like, gonna be a good boyfriend, gonna remember that. We'll do it again. And we do it again and she's like, eh. And I was like, what do you mean, eh? You loved it. She goes, yeah, but I want to kind of do something new now. Oh, great. So, this is very hard for guys especially to understand because we're like, but meatloaf good. Eat meatloaf all the time. Very good. So, I really do check in with my client, and you'll know what kind of person they are because they'll kind of share with you and stuff like that. And so you know if like this is a person that likes things just so and keep them the same all the time, and you can ask them too, Miss Suriel. You could be like,
I was just thinking after that will it be good to, when you see your client, say, hey, is there anything new today? Did you hike, or is there any area that is hurting where you want me to work?
Sure. Yeah, I love that question. That's a useful question. Are we doing anything new today? Because I think that's going to elicit a really good response. They're going to say stuff like, yeah, could you do like, I don't know, just something new. Or, yeah, I was hiking today. Or, no, man, I came here. I've been looking forward to what you do. Please do that. Especially that thing where you rub my ear down here. And I love that. Do that. All that. You know? So, yeah, it depends on your client's personality. That was my long-winded way of saying that. And you'll know. What Ms. Suriel has touched on, though, that is one of the hardest things for those of us that will have regular clients, which is probably all of us, is keeping the massage interesting for them. So most people would like to see a little bit of change in their massage over time. If you're getting a client every single week, they love what you do. That's why they're coming. But they wouldn't mind if there was something new on the menu occasionally along with that thing you did. And that's tricky, keeping it interesting and fresh for them. Yeah. And that is when you try new stuff. Keep the massage mostly the same and add a little new thing in. And I will tell you, by the way, this is also the area that most massage therapists fail in. Not doing that part. But staying interested in a regular client. Because they are regular. And you've seen their legs 37 times this year. And you saw them 42 times last year. And you're going to see them again. And you don't dislike their legs. My point is, you're like, you get a little complacent. And the client cannot feel that. You can't let that happen. So, if you have a client that comes to you once a week and spends $100 with you every week, that could be a 1-hour massage. If you're good and cheap, it could be a 2-hour massage. But still, a 2-hour massage once a week is not a crazy thing. That client is a $5,000 a year client. You only need 10 of those. 20 if you want to make 6 figures. That's not a lot. But that means I have to be interested in my 10 weekly clients every time I see them. Ah, George, so good to see you. I've been seeing George for 5 years. Still good to see him. Still getting enthused. Don't let yourself, you kind of got to bring your energy up. That's one of the reasons we do gratitude in this class and all that kind of stuff, is start to teach you. You're the person who sets the energetic, emotional thermostat in the treatment room. And you've got to keep it up. Your client's job is not to do that. Your clients will come in like this. Best people in the world come in like that. You're always the person that's happy to see them. You're always up here. Always for them. Even after you've been seeing them 3 years. Good questions. Thank you.
Thank you.
Thank you. And I love, Ms. Suriel, that you're thinking that way. Because the real point is just to be thinking that way. Am I doing what this person wants? My all-time #1 most hated question is, what type of pressure do you like? Don't ask this question when you're around me. Now you're going to do it just to piss me off. But I don't like it. It doesn't do any good. Because it doesn't mean anything. Miss Trotter, what kind of pressure do you like?
Well, now when I ask that question, I say affirm.
Okay.
Because we do have that question at Massage Envy.
Oh yeah, no, I understand.
Yes.
Yeah. Massage Envy is doing it to try to lock you up with the proper therapist, though. So if you're like, I like Psycho Deep, they try to put you with a #4, right? They rate you. They rate you at Massage Envy. I think Elements does this too. They rate you from 1 to 4 on pressure levels. And so somebody's like, I really like a deep massage. They're not going to give you to somebody who does a 1. And that's smart. But what I mean is, you just told me firm. What does that mean to me? Pressure is to a massage like spice is to a dish. You can't talk about it accurately, and it's very personal. So I don't like to ask about pressure because I find it to be extremely inaccurate. I really have had a lot of people say they like deep massage that I thought, you know, I just gave you a hug. We haven't even, I'm putting the lotion on your back. You think that's too deep? And I've had people that say they like light massage, and actually, in my opinion, they like a pretty rock and solid massage. So we just find that out in the treatment room. You guys know what I like to do here. I just like to say, based on what I've done so far, do you want more or less pressure? But again, what I also don't like about the question is it's very awkward and time consuming. People go, well, I don't, you know what, my back, I like it kind of deep. And my legs a little less deep. My hands, it's great if it's really deep, and then feet kind of medium. And I'm like, what? Did you just, I don't even know what any of that means. I just don't even know. Like, what's medium now, too? Now I'm really confused. So, anyway, just remember that. Don't ask questions that you don't want answers to. I will give you another one that I don't hate, but it just gives me a great example of this, and I want you to think about it. Most massage therapists ask, do you have high blood pressure? The answer does nothing. If you have high blood pressure, it will drop during the massage. It always does, because that's what high blood pressure does. I'm not worried that you have high blood pressure. If you walk through the door and you look okay, you're fine. But I've asked you now a personal question. We're now going to discuss your high blood pressure, and we're going to discuss what you do to take care of it. And we're wasting all this time, and I don't care. So just make sure, I've watched, not just high blood pressure, I've watched therapists ask questions where I'm like, you don't actually change your massage based on the answer. This is just what you do. And I don't think it's helpful, that kind of stuff. Ms. Suriel?
I'm so sorry for being asking a lot.
No, I'm not sorry.
Okay, so if you said that you don't like the question where you ask about the pressure, can you please tell us how do you approach? Because it's like going just deep with someone, and then how do you talk with the client about that?
So I do, for the first couple of minutes, I use some body language. But body language, by the way, that's another thing therapists will tell you. They go, I can tell how deep to go based on their body language. I'm like, no, you can't. Some people are tense all the time, and they do this all the time, and they're like, they're not hurting at all. Other people can be relaxed when it hurts. I mean, there's body language not good. But anyway, I massage them for a couple of minutes at what I would consider to be medium pressure and something appropriate to the body that I'm seeing. So if you're 102 years old, it's going to be light pressure. And if you're 25 and you came bouncing in here and you still got sweat on you from the gym, which is fine with me, but I meant like it's probably going to be a harder medium. But the point is, I just give you some kind of medium stuff, and I start massaging you, and I say, hey, Ms. Suriel, based on what I've done so far, in general, would you like me to be going deeper or lighter? Now, I love this question. It does two things for me. One is it stops Ms. Suriel from saying the pressure's good. Because if you ask people how's the pressure, they always say it's good. Yes, thank you, Ms. Trotter. They always say it's good. They're like, it's good. People don't pay $100 for good things. They pay $100 for great things. If I told you I went on a date last night, you said, how was it, Taps? I go, it was good. Am I going on a second date? Kiss of death. Good is not good. I need to know what to do to make your pressure better. And remember, they are nice people on your table. They don't want to ask you to work harder. And they might be embarrassed to ask you to lighten up, too. Like, not only do I not want to ask the sweet girl, Miss Trotter's working on me, and she's so sweet. We all know she's sweet. I don't want to ask her to work harder. I'm also embarrassed to ask her to work lighter, too, because I'm a man. I can take it, right? So she's got to force me into a situation, say, hey, Mr. Tapscott, based on what I've done so far, would you like me to go deeper or lighter? Oh, well, a little lighter, or a little deeper, or a lot deeper. Okay. And then Miss Suriel, I do a couple more minutes and I go, now based on my pressure, would you like me to go deeper or lighter? What I've done so far. And I do that usually in one or two times and we've got it. And I'm waiting for them to be like, nope, it's perfect. If I don't pretty much hear perfect, it's not right.
Okay, thank you.
And I will sound like a broken record here, but I'm going to say it again anyway. It's probably one of the top 3 most important things I can tell you this entire time, and I will say it over and over again. Pressure is the #1 unspoken complaint in massage. They leave and they just don't come back. They're not mad. I'm like, oh, Miss Trotter, she's sweet. I didn't want to speak up and say anything. She's such a nice young lady, but I'm not going back to her. And she wishes I would have told her because she wants me as a client, right? That's why you've got to make people talk. You've got to make them talk. Do you want more or less pressure? You want to hear the answer to that. And most therapists don't want to hear the answer because they want to hear they have to work harder. But you guys will find it's actually easier just to get it all right in the first place. So do you want more or less pressure? Not what kind of pressure do you like? By the way, I don't mind if you guys ask that question at the beginning, but just remember it's super vague. Super vague. I'd rather start working on you, and then find out what you like. If I was trying to serve you guys a 10-course meal at my house, ooh, that'd be good. And Mr. Blige was helping me, I hope. We might serve you the first dish and say, based on this dish, would you like more or less spice in your next dish? Because we don't know what spicy is to you. I've got friends that black pepper is like napalm. They're like, I can't handle the spice in this thing. And I'm like, I think it's black pepper. I don't even know if there's black pepper in there. Talking salt? These are Fruit Loops. What do you mean they're spicy? Are you crazy? And then I've got other friends that like tears are running down out of their eyes, snot is coming out of their nose, they're bleeding out their ears. They're like, it could be a little hotter. And I'm just like, I'm from New Mexico and we eat green chilies all the time. And I thought I liked really hot food. And then I went to Thailand. Woo! Had no idea. Totally changed my perception of what hot is. And I'm sure if I went somewhere else, it would change again too. So that's why I say all that stuff. I'm just looking to make sure I didn't miss any questions out there. Okay. All right. So I'm going to tell you what I do. I would not recommend you do this if you work at a chain place. But I will tell you, if you have a healthy individual in front of you, I think you can get away with just saying, what are we working on today? And are there any major medical conditions I should know about? Because basically you can get a massage unless you've got some really major stuff going on. And if you come in and you're like, hi, I'm already thinking you're medically probably okay. Any major medical conditions I should know about? No. And I say major because I don't want to hear about the last time you stubbed your toe or when you hurt your little pinky in childhood. I want to know about major stuff. Good. And what are we working on today? Oh, nothing. Just general massage. Okay, cool. Or my neck. I'm here because of my neck. Okay. I can explore that further then. And I'd say, are you here just because of your neck? Or are we going to spend the whole time on like your head, neck, shoulders, maybe never get to your legs? Very clear with them. Or do you want to just put a little extra time on your neck but still get to the whole body? And that sets us expectations with them too, right? Because they need to know that I can't make a 1-hour massage magically a longer massage unless they buy more time. So just because you told me you want me to work, because people will, they come in and they're like, you can spend a little extra time on my neck and my feet. Oh, and the legs, of course. And I'm like, well, you just changed your 1-hour massage into a 2-hour massage, right? So set up expectations. But those are the 2 things I would recommend you ask everybody is, what are we working on today? And are there any major medical conditions I should know about? At least ask that. I think there's a lot of other good questions you can ask, like, are you pregnant? Do you have low blood pressure? Low, I might care about. Things like that. Painkillers and blood thinners. Pregnancy, painkillers, blood thinners, low blood pressure are some really good things to know about.
I have a question.
Please.
So painkillers will give you the false sense of, pain.
Yeah.
Blood thinners, they will make you bruise easily.
Yeah.
What about low blood pressure?
Low blood pressure, the reason I'm worried about that one, is because you might pass out. And so, yeah, so it's funny, high blood pressure is very dangerous. If I was a personal trainer, I would care you had high blood pressure because I'm about to get you on a treadmill, you know, and then make you do supersets and stuff, right? So I'm worried about you having a heart attack or a stroke or something. But as a massage therapist, we know that your blood pressure will either stay the same or drop on the massage table.
Drop. Okay.
It'll drop. Almost always it drops. And then, the problem is not during the massage. I'm still not worried about the massage. I'm worried afterwards. When you get up really quick and you've got low blood pressure, I'm worried about you getting up really quick and passing out and hitting your head.
Yeah.
So, and that is actually a bigger danger than like when we have problems at spas and stuff, it's not usually because of the massage, it's because somebody slipped and fell. Unfortunately, slipping and falling is still the big stuff. And if you ever see somebody kind of going by you, a client, like falling, try to remember this because it's very tempting to be like, oh wow, is she? Boom. That's literally what goes through your head. Oh wow, is she? Boom. Don't. Reach out and grab hair going by. They'll thank you. I'm not trying to stop them from falling. I'm trying to stop their head from falling. And I will grab your hair on the way by. If I saw one of you guys, I love you guys, going by, I'd be like, and I'm just trying to slow down the fall so that you just fall over and we can laugh about it and you don't hit your head. But anyway, that's why the low blood pressure. Yeah. And the pregnancy, to be honest with you, I'm not even worried about it at all as long as it's normal pregnancy. If you're healthy, pregnancy is not a disease, no matter how we seem to try to treat it sometimes. But I was just trying to think of other questions that I might ask as a therapist because I tend to be very lax. I totally admit that. Good. Good questions. Yes, Ms. Lovitz.
At some point in the course, are we going to go over pregnancy massage?
Yeah, yeah, we do. We do. We go over do's and don'ts and how you'd approach it and things like that. Yeah, we do. I have a whole presentation on it. Yep, we will. Very quickly though, Ms. Lovitz, essentially, if the pregnancy is going as planned, which is my favorite question to ask, is this pregnancy going as planned? Everything's fine, no complications. And I hear the word yes to that. Don't have them lay on their stomach. Go ahead and massage them. You know, don't have them lay on their back either. We'll explain all that too. Usually you work on their side. But that's the big stuff. Yeah. You can even do fairly deep massage on a pregnant person. If they're healthy and if they're used to it and all that kind of stuff. The biggest problem, and I'll say this again when we get to pregnancy massage, but the biggest problem with pregnancy massage is lots of people have miscarriages. That is a natural fact of life. I do not want to set anybody off, but I'm sure many of you have experienced this in this class. That's the way Mother Nature works and stuff, and it usually happens in the first trimester. And what we don't want to have happen is I give you a massage, you have a miscarriage, and you think the massage caused it. There's not a single documented case in history of that happening, but we sure wouldn't want you to think it happened. So I'm often trying to just make sure, is this pregnancy going along normally? Because I would hate for you to associate the two things together, right? But massage is super safe. Super safe. Okay. Any other questions? So your book goes over interview skills. I've already been kind of talking about this. This is where you are actually interviewing the client. Just remember that the client's interviewing you too. And I think that's one of the reasons I don't ask a lot of questions is I want to come off confident and that we're going someplace. I sometimes think asking too many questions shows a little bit of like I'm nervous, and I do not want to be nervous for the client. I often am nervous, but I hide it inside. So I get nervous before teaching you guys sometimes, but I just am like, we're going to do it. It's going to work. It's going to be okay, right? But also pay attention to their body language, and I listen a lot to tone. So when I was explaining to Miss Suriel that I work on you for 3 minutes and then I say, do you want more or less pressure? I not only listened to if you said more or less pressure, but the tone you say it in. It's super helpful. So you might say, oh yeah, more pressure. That tone is like sure, solid. I'm actually going to apply a lot more pressure because of the way you said it. Whereas some people are like, I could use a little more pressure. That is a person saying, I do want more pressure, but I'm scared you're going to hurt me. Right? So the tone is very important. So just watch all that stuff because tone tells you a lot. Right? I also look at body language. If this client is closing up around themselves in front of me, I already know we're going to have lots of issues with how comfortable they feel naked in a room with me. So I'm going to try to minimize those, right? Whereas you get those clients, they're talking to me, I'm like, do I have any major medical conditions there? Are you taking their shirt off? I'm like, whoa, wait, just, okay. I'm going to step out of the room. So that person's not. So body language is super important. Most studies suggest that we get about 80% of our communication from body language, only 20% from what the person tells us. And it's really true. I mean, think about it when you guys see each other walking down the hallway and things like that. We really kind of make a lot of assumptions based on that before we even hear somebody say something, you know? Okay, we are not going to go into gory detail, but we will talk about treatment planning. We will talk about treatment planning also a lot more much later in this course when we kind of understand kinesiology better and can make some assumptions about how we might want to work on somebody. But the idea behind treatment planning is that you have assessed the client, you both know what you're going to be working on, and you're looking for progress, and this is where SOAP notes can be helpful, or any kind of note. I know that I'm working with soft tissue with you. You're my client, right? But I am looking, if you've come to me with a problem, I'm looking for the problem to get better. And if I have done the same treatment on you 3 weeks in a row and we're not showing any signs of change, then I might need to rethink my strategy. And that happens to me all the time. Because please, please, please believe me, we are guessing at what's wrong with somebody. Now, and so are doctors, by the way. Everybody's guessing. You're just hoping they're making highly educated guesses. And we are. We're going to make highly educated guesses, like based on my understanding of how kinesiology works and you're standing, I bet you have these tight muscles in these areas, I'm going to try to work on those. Great. But I might be wrong. And so if I don't see any change over several massages and you're not reporting back that you feel it all better, then I might be like, oh, I thought you had an anteriorly tilted pelvis and that was causing the problem in your back, but maybe it's the problem in your back is causing the anterior tilted pelvis and I should switch up my massage. So we will get to all that. I just want to explain to you, that is one of the real good reasons for treatment planning. Is because you will sometimes look, and I've done it before many times actually, look back over my notes and been like, oh man, I've seen John 3 times. We keep doing this. He keeps coming back and he is not getting any better. I'll talk to John. John, are you any better, really, honestly? People appreciate the honesty. Well, no, but you know, I knew it's going to take a while. Well, I think it's going to take a while too, John, but we're not seeing any progress, so I'm going to try some different stuff today. Yeah, that kind of thing. Treatment plans are a good time to find out if there's anything the client wants you not to do. That is a helpful question. Like, is there any areas I should avoid? We are not going to get into the PICO method because it's just a different method of SOAP notes. Your book will talk about it. It is very similar. And there's the PICO method and the BICO method and the master method. And there's 1,000 methods, but all basically get information from the client, information from you. What did you do during the treatment and was there any improvement afterwards? We do the same thing in school with you, right? We kind of say, hey, you're going to learn massage therapy. We tell you about some massage therapy. We give you a test to see if it actually stuck any of it. And then we assess things and move on from there, right? But anyway, with the PICO method, we're really asking, is the massage working? And with the SOAP note method, we're asking if the massage is working. And with the notes that you take on a cocktail napkin and stuff in the locked filing cabinet in your house on your clients, that's what we're looking for. Is this client getting better? If they came to you, by the way, with a problem that needs to get better. Some people might come to you every week. My mother has gotten a massage every week for the past like 30 years. They're not working on anything. She just likes to get massage. She likes massage so much she goes to 2 therapists and rotates them. So 2 weeks out of the month she gets Betty Lou, and the other 2 weeks she gets, I don't know, Magnus. Sounds like a good massage name. Magnus. That's the therapist I'd like to go to. All right. Okay. Remember, with any types of surgeries, accidents, anything, at least wait a couple of days before you work on them, because we don't know what pain is going to come from those things that will be attributed to your massage. So I think the industry standard is 3 days. I say 2 after an accident, but just always be reasonable if somebody's gone through something major. And major surgery, like the open heart surgery guy on my table, really should have a doctor's release at that point. He was already on my table. I went ahead and worked on him. I didn't, do any work on his chest. And I worked on his back with him face up, so I wasn't pressing him down on the table. And that can be done, and we'll learn about how to do that in this class. But that kind of stuff you need to be careful about. You can refer clients out. You can't give them advice like you should eat this way or exercise this way, but you can refer them to people. It is okay to tell somebody like, gosh, that sounds like you're really struggling with this. You might, maybe you should get some professional help with this. I'm not really a licensed, psychoanalyst, or I'm not a chiropractor, or I'm not a whatever. Feel free to refer people out if that kind of stuff happens. There's nothing wrong with that. We already talked about this a little bit, but informed consent. Informed consent means the client has given permission to you to do the thing you're going to do. Now, I think some places get a little carried away with informed consent. They ask everything, like, is it okay to have secondary contact, which really just means my leg rubbing up against yours. And in many places, for what you're doing, that's completely appropriate. I don't think you have to ask all those questions, but informed consent is very helpful in these type of situations. If I'm doing a standard massage to you, I don't actually get informed consent for that whole thing. I'm pretty sure you know I'm about to rub your body. But I get informed consent for things like this. This happens a lot to me. I'm working on somebody and they go, actually, you could go even deeper there. And I'd be like, I'm happy to go deeper there, but I'm actually worried we're going to damage you and you're going to be sore tomorrow, really sore. I'm still okay with it because I don't think we're going to break anything, but you're going to be really sore. Are you okay with that? I'm actually seeking informed consent right there. I've just told them, if I do this thing you ask, I think you're going to be really sore tomorrow. Really sore tomorrow. And it's very helpful. And I would say 50% of the people go, oh yeah, I don't care. That area bothers me so bad I'd like to have a new soreness there. And you'll hear that exact statement. I'd like a new type of pain there. That's common. But I also have people who go, oh no, I didn't want to be sore. Oh, then I think we shouldn't go any deeper then. Because based on just, the thousands of massages I've done, I think you're going to be feeling it. But that's informed consent. Do it with cupping. Cupping's quite safe. You could have bruises on your body that are perfect circles, which I don't know if that's a good thing or a bad thing, but they're perfect circles, and they could be there for a month. And we've definitely had that happen in this class where we've done cupping on people and the bruises are there for a month. That's fine if the person's like, yeah, I don't care. But can you imagine, like at a resort doing that? And it's their honeymoon, and she was going to wear a backless dress that night, but now she's got 16 perfect circles on her back from cupping. And I've seen stuff like that happen a lot. Yeah, where we just didn't get informed consent for something that the person thought was cool, but they didn't know the whole thing that was going to come with that. So that's informed consent. They really should know the benefits and the risks of what they're going to do. Don't overdo it. You don't have to be like, do I have consent to rub your back? Of course you do. That's why they're there. But if it's going to get crazy and you're going to do cupping or you're going to do something else or you think you're going really deep, or if I think I'm going to, maybe you came to me with hip problems and I'm going to work your glutes directly, not through the sheet, but directly, and I'm not sure if you really realized that when you said hip problems, I might say, is it okay to actually have my hand directly touching your glute and I'll touch it through the sheet here? That's informed consent too. I really think I need to do that to get in these hip muscles, but I want to check in with you. And remember, we listen to body language too. If you go, Yeah. That's not informed consent, by the way, right? I really need a, oh yeah, yeah, that's totally cool. Because yeah, I would literally, if you told me that, I'd be like, okay, we're not doing that. That's not consent. Consent is enthusiastic. All the things that imply to, like, sexual consent apply to massage consent, really. They really do. And not because I'm comparing those two things, but just because that makes sense. Okay. Oh yeah, I will say one last thing. Remember that when clients are giving consent to, that they are in a vulnerable situation. Right? So, I'm sorry, Ms. Trotter, for whatever reason, you're my example today. But if I'm giving Ms. Trotter a massage, I am older than her, I'm bigger than her, I'm a male, I have my clothes on, she's naked. That's a lot of intimidation right there. I need to remember that an intimidated person is answering my questions, and that's why we really have to kind of listen to stuff. So don't put your clients in awkward situations in the room. Like I worked with a guy who had to go for extra ethics training because he asked his client out, a regular client out, in the massage room. And what the board busted him for was not asking his client out. Believe it or not, that's not a good practice, but it's not exactly wrong. But his client had a very legitimate complaint. She said, I didn't feel like I could honestly answer that question. This guy's huge too. When I'm in a room naked with the massage therapist asking me out. I mean, yeah, those are the proper facial expressions. The client needs to be in a position where they really feel okay. Like, as much as I want to rebook you even, I don't ask that question right now. Like, okay, Ms. Trotter, did you like it? Are we going to rebook? She's like, well, can I put my clothes on, weirdo? You know? Oh, okay, well, I know, but, we talked about it. We did talk about the fact that you should probably come in more often. Can I set you up right now? Like, that's very intimidating, actually. So just remember that. Remember that you have because you guys forget. You're just massaging. I forget. But that person's actually quite compromised on the table. Okay. That might be all. Is that all the highlights? Yeah. We already talked about scope of practice. Any questions so far? Where is that? Oh, yes, Miss McDowell. It's about
Hi,
time. What's your question,
I
ma'am?
had a question earlier, but you ignored my hand. I'll let that go. But
I'm sorry.
you were talking about the like the pressure thing earlier, and I mean, don't you kind of do that anyway when like you're switching your tools from like your fingertips to like palms, fists, elbows, like it. I mean, I would say something like if you put your elbow like in my spine, I'm gonna be like, okay, ow, that hurts.
Yes, you're right. And we would know that right away.
I mean, I know you have to like ask, but isn't kind of like changing the tools kind of like a way of asking, or sort of in a way?
I need you to elaborate a little. I need you to elaborate a little bit. So. I don't actually understand what you're saying. I'm very close to understanding, but I don't understand. Do you mean that it's an opportunity for me to talk to you about pressure, or the fact that I'm talking about using my elbow as a chance to automatically guess? I don't understand what you're saying.
Yeah, so like when like the effleurage, so if you're doing it and you start to, then after that, if you've gotten through your tools, then you go to like a petrissage or Topman or this or that. I mean, do you have to be like, okay, can I start this? Can I, do this? Or do you just kind of do it and then see if they're like, ow?
Well, so you're talking about pressure or an informed consent about what you're doing?
Kind of both.
Okay.
Really.
Here's what I think. And I say think because other therapists have solved these in different ways. As important as I think it is getting the pressure right, and I think it is the number 2 thing you've got to do. Number 1 is you've got to be super nice. Super nice. But number two, you got to get the pressure right. As important as I think that is, you can overdo it, and we get complaints when people overdo it. And it's a very natural, nervous thing to do. And so I've received here in this clinic here about students many times where people in surveys say, great that they asked me if I wanted more or less pressure, but they don't have to ask me every single body part, which I think would tie into every single move. So as much as I want you to get the pressure right, once you think you've got it right, you need to guess for the rest of the massage. And I don't mean never, ever, Miss McDowell, but I would, guess. You can guess pretty well. So if I know you like, I hate this kind of terminology, but let's just say I know you like what I think is a 7 on your back. I know that backs can take a lot more pressure than almost any other area of your body. If somebody can take a 7 on their back, they probably take a 6 on the back of their legs, a 5 on their inner thigh, or even a 4 on their inner thigh, because inner thighs are more sensitive, right? They can probably take a 10 on their hands, strangely enough, because hands are just tough. Like, I'll make those kind of guesses, if that makes sense. And here's what I'm really doing, and I don't know if I can explain this over video, but I think it's super helpful. I'm using terms like deeper and lighter, and I'm using them with you, and I use them with other therapists, and I use them with the client. But I'm actually not thinking in those terms. I'm thinking in terms of how much fascia am I moving. So, some people when you rub, all I feel is my finger rubbing over your skin. Other people when I rub, I start to feel myself catching their fascia. Other people when I rub, I can actually feel the gristle in there going. That's what it sounds like in my head, right? As I'm stripping through your stuff. I'm really setting that in my head. So when I'm going through your back and doing these moves, and you go, yeah, that's perfect now, I'm really thinking, how much resistance am I getting? Right? Because if I do that on your face, I obviously need a lot less pressure here. There's only that much space to get that same effect. And so I'm really thinking about drag and about how deep I am in your tissue, not how hard I'm pushing, if that makes sense. And then I guess for the rest of the massage. I really do, unless I get some weird signals from you. So you get a lot of twitchers. I don't know a better term for them. And there's nothing where there's somebody here who's a twitcher, so don't worry, or 10 of us, doesn't matter. But what I mean is somebody who just in the massage just twitches sometimes, right? That's very normal. So sometimes I'll be massaging somebody, we set the pressure and then they twitch. And I'll say, was that too deep there? And they'll say, nope, it wasn't. And then they'll twitch again and I'll be like, you okay with the pressure here? Yep, I'm great. And I can tell by their body, their voice and everything, they're great. I don't ask the question anymore. I've asked them twice. I now don't want to make them feel uncomfortable that they're a little jumpy, and I'm going to go back to guessing. So I will occasionally check in if something sets off my spidey sense, right? Like they're jumping.
Yeah.
But in general, I don't ask again. And after I set the pressure in the first 5 minutes in general. So don't over ask. And so I definitely wouldn't ask every time I switch tools. And I don't ask permission to switch tools. I don't ask permission to switch from hands to elbows, to anything like that. I do ask permission to, like, let's say, get up on the table. So in Thai massage, you can get up on the table and do all, and it's completely legal. I would ask permission for that, especially if you were not my regular client, right? I'd be like, is it okay if I get up on the table here and, put my knees in your glutes and things like that? Those are certain things to ask permission about. But no, ordinarily, set the pressure. Unless I'm doing something crazy, I'm done. I hope that answered your question.
Yeah. It kind of makes, I kind of had like an idea, but I didn't know, I was kind of talking about, like, switching styles, like, if it was, like, something different, like if you went from, like, effleurage to, like, trigger point, like, I don't think that's a natural progression, but...
I do.
I don't know.
That stuff seems to take care of itself, Miss McDowell, because they're probably going to, because they like your blend of styles.
Okay.
Yeah. But I hear what you're saying. But yeah, I probably wouldn't even, I don't know. I probably wouldn't even ask permission for that. Yeah. Because it's not, I don't know, if I was going to do something crazy, like now we're going to do the flaming elbow style, I might ask about that, whatever that is, but no. You'd be fine. Yep. Most clients, not all, Not all. Some clients come in and they like to really actively participate. Some athletes do. They like to actively participate in their massage, do the stretching with you, fight against your stretching, so that we can do like what's called PNF stretching, which we'll get to later. But most people want to chat for a few minutes. Most people, I'm just saying about 85% or something like that. They want to chat for a few minutes, and then they want to be left alone while you massage them. They don't want to be asked questions during the massage. They don't want to be bothered. They want to be like, "Hi, Miss McDowell, I'm so happy to be here. Yeah, it's that spot again. Oh yeah, nope, that pressure's perfect." And now they're like, "And now you can leave me alone." And I tell you all that because the other thing that I've received a lot of complaints on when I was a manager was my therapist kept talking to me through the treatment. It's a pretty common complaint. And when we go talk to the therapist, what they say is, "Well, they kept talking to me too. So of course I kept talking." And then we talked to the client said, "Of course I kept talking to them, I was being polite." If you're the naked one in the room again, and somebody keeps saying, "So, how are the kids?" Do I feel comfortable to say I don't really feel like talking right now? Yeah, so we do actually a little trick that you guys, I think, should all try in your massage. It's not covered in this slide. I don't actually ever talk about this, but when I used to coach therapists about this kind of stuff that were having a problem with this, where they're like, "But they wanted to talk." I'm like, "That's not what they're saying." I let all massage conversations die 3 times in the massage. So you're chatting with me, boom, boom, boom. Some of my clients, you really like them. They're really cool. And you're bored. You'd love it if they talked to you. But occasionally I just...
Okay, you can.
Oh, good. Okay, I was about to write in the chat thing. And I don't start until they reinitiate the conversation like Miss McDowell just did. But still, halfway through the massage, she might want to take a little nap. Most people do. They want a little bit of downtime. So we keep having this great chat. Miss McDowell and I are like, boom, boom, boom. So we get to catch up with you. How's massage school going? All that stuff. And I wait till she starts the conversation again. Just to let her be in control, because remember, she's naked. I know I keep saying this, but it's intimidating. Right? So she's going to be polite. People are polite. They normally are. And so I don't make her be in a bad position where she has to tell me to shut up. Nobody wants to tell her therapist, like, "Hey, could you stop talking?" Like, nobody's going to do that, right? So anyway, that's it. Let your conversations end with clients a few times during the massage, and some people will keep sparking them right back up. They love to talk during their whole massage, and I love those people. But some people you'll find you let it drop, and there's 45 minutes of quiet, because that's what they wanted. Yeah. And obviously I don't end it in halfway through my sentence like I did with you guys. I was trying to make a point. I'm just like, "Oh yeah, that was really good. Yeah, we had a good time too." And then I stop. That kind of thing. Cool. I think almost final words of wisdom here, by the way. You or your client can end your massage session at any time for any reason. And I actually wish I would have wrote, you can end or your client can end the massage session at any time for no reason. So I tell you this for 2 reasons. One is, if a client wants to end a session, don't argue with them. It probably has nothing to do with you. 99% of the time, they're having some bladder problem or they just got triggered from some trauma they've had or whatever, and it's not really about you, and they're not mad at you, and you're fine. But it's so weird and abrupt that you're like, "Oh, well, I don't," but they just told you they want to end the session. Be like, "Absolutely, I'm going to step outside. Get out of there. Because whatever they need to do it fast. Maybe just go to the bathroom. but let your client end the session, because it's very normal, because we're caregivers, to be like, oh, well, but can I do something to make you more comfortable? This is not the time to negotiate. If a client wants to end the session, end it. The second thing I want to tell you is you can end the session. And all therapists have different rules of thumb of when they might end a session. My rule of thumb is I'm very permissive, actually, not in a bad way. I'll explain here in a second. I believe that anybody is allowed to do anything with... I believe that anybody is allowed to ask me anything. One time. So a client is allowed to ask me out. I don't think it's the best thing in the world to do, but I don't think it's the end of the world. A client is allowed to ask to have sex with me, believe it or not. I'm not going to. And I'm going to ask them not to bring that up ever again, and they have to stick with that. But I believe anybody can do that. Many therapists will leave the room right at that point, but I won't. But I believe that if a client touches me when it wasn't welcome, or a client does something that I told them not to do again, I end the session immediately. So if you ask to have sex, I'm sorry to be so blunt, but these are worst case scenarios. You asked to have sex with me, I said, hey, no, I don't do that, and I need you not to bring it up again. But I keep it lighthearted, because I don't want to embarrass you. It's totally cool, but you need to not bring it up again, or I'd have to end the massage. And you bring it up again, I don't even explain myself. I walk out and close the door. Not because I'm mad, because we're done, and you need to believe me when I set a boundary. Or if you touched me, and I don't mean accidentally. Clients accidentally touch you all the time. It's fine. Don't freak out. But you are, I don't know, stroke my face, something weird. I'll leave the treatment room, because it's just, we've gone way over a boundary. So you guys have to kind of decide. But what I don't want you doing is sitting in a room because you're nice people, and you guys are nice people, and you're like, oh gosh, I don't know if I should end the session. I'm really getting creeped out by this guy. But you can leave. You can leave. You're not breaking the law. You can't charge that person at that point, but you don't want to. You don't want to see him again. There's something off here. This is a very unusual situation. This does not happen often. And I want you to always remember, you can just get up. Don't explain yourself, because if somebody's trying to victimize you, that's where they get you. They go, well, I wasn't doing that. You shouldn't feel that way. You're making a big mistake here. Don't have that discussion. Just leave. Just leave. Just leave. You can end the treatment anytime you want. Anytime you want. Just do. Questions? Comments? No. And by the way, don't worry. That's not like that's a common thing, but I just want you to realize it can happen. Yeah, we're not going to do documentation. Okay. That, dear class,